Good morning, everybody. It's me again. I had a really neat case in the office yesterday, and I wanted to share it with you. Whenever I find one of these little golden nuggets, I feel like I want to share. So here's one. Yesterday I had a patient who came in who had been in a car accident, and in case you don't know, chiropractors often see people in accidents. I don't because of my specialty in pediatrics, but when one of our existing patients is in a crash, I certainly take care of him. And what happened with her family is that her husband was driving the car and she was in the passenger side, and somebody made a left turn but broke through a light and made a left turn in front of their car, and their car T-boned the other car. The other car, I think, was totaled, and their car was either almost totaled or soon to be called totaled. So we're going to find out about that soon. And so immediately, and also, by the way, she said that probably the car was going about 45 miles an hour when they hit. And she kind of said, well, it was only about 45 miles an hour. And I went, only 45 miles an hour? That's pretty fast, and that's a pretty high hit. But she was very businesslike about it. But then she said after the hit, police and ambulance came and so forth, and she was very frightened. Like, she couldn't sit. She couldn't, really stay in one place for very long. She was panicking. And she said this was a feeling that lasted for several hours before she could calm down. Some of us would call that like sympathetic dominance, where the sympathetic nervous system, which is your fight and flight part of your nervous system, gets you ready to attack or run, is really firing, and you have trouble regulating. So, but after a while she did calm down, and she came to see me, and she kind of came into the office. She didn't let us know that she'd been in an accident, so as soon as I heard, oh, by the way, we were in a car accident 2 days ago, Dr. Eric, I went, well, let's take a step back and talk about it. So, a couple of days, so I saw her, and then we saw her again just yesterday. And when she came in, she was having, pain in the neck. She had what we would colloquially call a whiplash, and, kind of limited, careful range of motion. So I said, okay, well, let's take a look at the neck here today and see what we can do to help you. So I started doing some functional muscle testing. I tested the deltoid, which is innervated by the lower cervical nerves, in an attempt to see if we could get something to come up. I tested all of the vertebrae of the neck, and wouldn't you know, nothing came up. So that's kind of weird, because you have a real injury here, and the patient's in pain, and she has limited range of motion, but nothing is really showing me through this nerve root that anything is going on. So I went back. I said, it's tender, right? It hurts? And she's like, yeah, it's really stiff. I said, okay. And I thought, there's something else going on here. So I had the patient lie on her back, and we started an AK procedure that's called switching. Switching is when the practitioner finds they're getting funky results. It's kind of like when you ask somebody a question and they say yes and no at the same time. The answer really has to be yes or no. Muscle testing is a binary technique, not a graded one. So I checked a few acupuncture points that have been found to be helpful for this, namely kidney 27 points and also the central vessel 8, which is right over the belly button, and she became weak. So what I did was to stimulate these acupuncture points just with my fingers, and then we went back and retested, and it looked good. And I went, maybe there's still something else. So I had the patient think about the accident for a moment, and the leg muscle that I tested went weak, and then I had her put her hand over her forehead like this. There are 2 points on the forehead here, which are called neurovascular points for the stomach meridian. And what they are really known for, and have been known for probably 45 or 50 years, is to help calm emotional responses to an illness, to an event, or whatever you have going on. So when she contacted these points, I retested the muscle and it went strong. And I thought, maybe there's a little bit of a holding on to the feelings about this accident. It really was very frightening, and as far as I know, she didn't have any care around discussing the events of the accident. So I went to the top of the table, and I held these points for her, and I had her think about the accident. And, we started with them just driving down the road as they normally would on any morning, and then to think about the events, and that when she was done, just open your eyes and come on back to me. So she did that, and what happened is she started to cry and cry and cry on the table. The event was just really that scary and upsetting. And not only that, but she and her family were in the car. There's a lot going on that day. So eventually she stopped, and we went back and retested the memory of the car accident, and that was clear. And then I had her sit up, and I said, how's your neck? So she went and felt it, and she's like, oh my gosh, that's so much better. And immediately a lot of the tension that was holding this neck so stiffly was not there anymore. So check it out. She still has a whiplash. There was an accident at 45 miles per hour. We can't just take that away in a second, although there's some things we can do to make her much more comfortable. But the point of this is that when somebody has a really emotional or frightening experience like this person had, that it affects tone. When the hippocampus of the brain is infused with blood in remembering a trauma, the body holds itself in a position such as to prevent them from getting hurt again. It's almost like the brain thinks that the trauma is still happening, even though it happened a week ago or more. So this technique of what they call emotional recall and also switching in applied kinesiology was very helpful to turn off the stress response that the patient was having so that the muscles could relax and we could do further work. So after that, I went on to actually do some percussion of the spine in the related areas. I used something called a vibrocussor, which is very, very gentle, and it helps to undo fascial restrictions, and it also returns the piezoelectric effect to the bony tissue. It also feels really good besides. And then we determined that some niacinamide and B6 would help with the actual healing of the sternocleidomastoid muscles. But the truth is I couldn't really gone and done those other things that we think of as being really therapeutic, like the stuff to do for the neck, unless we had gotten rid of this emotional overtone that was driving her to hold so much stress in her neck. So she was really kind of amazed, and I was kind of amazed, I have to tell you. I've been doing this stuff since I was 15 years old, but I never get tired of it, I have to tell you. Like, the results are just that awesome. And it's an example of how we can use classical manual therapies along with the applied kinesiology that incorporates different levels and different aspects or factors of care. And in this case, the emotional one was really, really important. So anyway, that's my story from yesterday. It was such great fun. As you know of me, I just love what I do. And I'm always learning to help serve my patients better and to get even better results. So that's the end of my story. Does anybody have a question or anything while I'm here? I want to say hello to Eleanor and to Danielle, who are here with me. Anybody else? Maybe not. Okay. Well, that's cool. Oh, and Jesse, too. Hey, man. Kicking it in New York over there. Oh, I see someone has a, let's see. Someone has a comment, I'm sorry, about that this is, who says this is very real, even for minor accidents, such as she experienced one and felt, the impact of the emotions. So, yeah, it really is it's really a big deal. I always say to my patients, some patients come and say, I had a car wreck, it was no big deal, and I'm like, you know what, I got to tell you something, car accidents change a person's life, they really do. And not just the huge devastating ones where there's real loss of function in life, God forbid, but also minor ones where you just didn't see it about to happen, or even if you did see it about to happen, it really changes the overall tone of your nervous system. So that's something to bear in mind. And I don't think we really deal with that enough. You know, sometimes people go to a psychologist because they have trouble getting back into the car. I've had that happen with a few of my patients where, you know, they never had a problem in their life getting in the car, and then they had an accident, and here they are, they're on that same stretch of 66 on that ramp where they got hit, and then wow, they can't even handle it. Huge panic attack. They have to have someone drive them even, all kinds of things. So that's where techniques like the one I just described, and also neuroemotional technique, which is NET, has been very, very helpful. So it helps people recover their ability to be calm in a situation that even looks a little bit like their accident. So thank you for that, Eleanor. That was a great comment. Anyone else before we finish up today? Okay, well, I think that oh, wait a minute, here's someone else who says, even if you're in an accident and you lose consciousness, God forbid, the body still seems to remember where it is sometimes in the midst of an accident. The brain is really amazing that if it finds that whatever you're going through in life is too much, too overwhelming, it will actually shut you down. We call that fainting or passing out or whatever. So sometimes, you know, that's one of the benevolent things about the brain. It knows when you've had enough. And she's mentioning she was conscious, not concussed. But both are the same. Both are true. Okay. Any other questions? Thank you for joining us, Julia. Happy to have you. I'm about ready to wrap this up. Thank you, everybody. I appreciate you hearing my story this morning. Hey, if you know anybody who has these kinds of issues I described today, get them to an applied kinesiology chiropractor. You know what? Not just me here in Northern Virginia, but I see people who are joining in from all kinds of places, out of state and so forth. There are really good doctors out there who can help you with this integrated approach. And I really think that that's where we're going in healthcare today, is an integrative approach. People are no longer, you know, satisfied with just, you know, checking off certain boxes. They want to bring the whole body, mind, and spirit together. So if you ever need anybody, you know what, give me a call, and we'll help you find somebody too. And that's all I got. So have a great day today. Soon I'm going to be reporting on my results on Dr. Leibowitz's protocol that I spoke about, I think it was last week. I just started seeing a patient with that technique, and I'm looking forward to hearing about her results very, very soon. So rock on, everybody. Have a great day. Get adjusted. Drink water. And take care. Bye-bye now.